Yes.
Okay, we'll call the Health and Human Services Committee to order. And our first order of business is to accept the minutes from September 25th, 2024 from Rick Scott, second by Nate. All those in favor?
Aye.
Okay, we have department request reports. Lee, Shelley,
Hello?
morning.
What's for each of you? I'll be quick today. I think they're enough to do it. Oh, yeah, absolutely. Good morning, nice to see everybody this morning. So I am here today for our quarterly report on our contractual services for the food pantry and our senior transportation services. On the first page is just a couple of graphs. Shows, this is specific to the food pantry. Shows our cumulative growth by quarter and total number of people served. And the one below it is cumulative users by year with a monthly breakdown. That's over the last 3 years. So with both of these, you can see that the total households served has increased just in the last 3 quarters. And the cumulative users by year has increased year over year for the last 3 years as well. We have the highest numbers we've had in a long time right now. And we are, I've got some other data for you, but we are also in the process of switching to a new data platform, data and client management platform that I think is going to give us richer, more robust data so we can try to determine a little bit more about the people we're serving. I'm hoping that that is the case. We're really excited about it, and it's agency-wide, so that'll be good too. As far as the food pantry and transportation is concerned, that switch is taking place now and will be fully in place by the end of the year. So next time I report to you, I may be able to have a little more detail. On the next page, what you see is the financials from our food pantry for this quarter. Well, year to date from 1/1. We always do year to date with our financials. We have done we've been working pretty aggressively to try to fundraise for the food pantry. And we do have, not reflected here because it was not in this time period, but we do have a one-time discretionary grant from CSBG, the Department of State, for $15,000. That will show up in the next report that you see, I believe. And so that has been helpful. We also applied for a grant with, again, discretionary funds, but this one was through the Office of Children and Family Services through Carrie Warner. I met with her and she offered this opportunity. So that has not yet been awarded, but we are hopeful that we'll get that one as well. So our fundraising efforts for the food pantry we're working hard on them. So right now, this year, we are at a deficit with the food pantry of just under $1,700. You can see that the food pantry inventory costs they remain high at $13,000 to $16,000 per quarter just for supplying the food. Stop me if you have any questions, or you want to try to get through it quickly for you. The next page is really just the data that's on the first page on the graphs, just that raw data for you. And then, I did want to make one comment, I'm sorry, on the graph. On this, the first graph on the top graph on that first page, the cumulative growth by quarter, you see that what has gone up really consistently is the cumulative total of individuals. The cumulative new users, I don't have time for that word, has remained relatively level. And the total households has increased a little bit. And this is where I'm really looking forward to that new platform, hoping we can get some more robust data, because from this, what I infer, but I'm not positive, is that what we're seeing in our new users is new families. Because our total number of new individuals isn't growing much, but our total number of new users, I'm sorry, our total number of new individuals, absolutely, raw count of people is increasing significantly. But new users and total households is increasing, so I would think that would be a head of household coming to apply for services with several people in the household, and that's why the individual number is going up. The household number is going up, but not as dramatically, but the new users is not going up so much at all. It's just those that are new users are families. That's my inference. I'm not positive about that. But that's what I have anecdotal reports of more families coming in. So. Any questions on the food pantry piece?
One question on your new users over new households. Is it possible also that households are bringing in more members from extended family or situations to grow the individual names?
From extended family, only if they're within the household. Because we do, obviously, it's possible that people could not give us accurate information, but we do ask for a household structure. We get that household structure, how many are in the household and all that sort of thing, when we do an intake with people. So if we do have people that have extended family or others in the household, then yeah, that's possible.
Are they able to grow it if a brother or sister
Moves in?
Yeah, moves in, so, okay.
Yeah, so if people, there's a bit of a housing crisis right now, so if people are starting to couch surf in other homes or share residences, that would reflect, that would also have to see an effect. Yeah.
All right, I'm still trying to understand this same graph. So it's new users is not a definition, the definition of new users does not include individuals. There aren't, if we all went down to the food pantry, we would be 25 new users, we'd be one new user because Dan made the application. Is that how this?
New
my
users.
address?
Yeah, new users are the person that applies.
Okay.
That's the individual that applies for the household. No, it's not, and that's why I'm really hoping with this new software, we can dig into these things a little bit more and get some more detailed reports, but we can see that our overall usage is going up. I would like to know what's causing it. And I would like to know what's causing it as we're watching the trend, not afterwards, and try to figure it out. So that's what we're working toward right now.
Yeah, I mean, it really had a significant, exactly how many people we're serving, how many households.
We do have that.
Well,
We do have total, I'm sorry?
That's a big number from the first quarter to the third.
Yeah,
It's like triple.
Page 4, right, Shelley?
yes, this page is more of that data. I picked a few numbers to show graphically, but. So this shows our total and month by month and the percentage of increase. 2022 to 2023. Of course, we haven't completed 2024 yet, so we don't have that for every month. You'll see the total number of food pantry users there. Individuals. And I would be very happy to try to report any specific numbers you'd like to see. If you know now and want to share that with me, or if you want to email me and let me know, I will get whatever numbers you want. As long as I can.
it looks like we're pretty steadily increasing by about 15 families a month.
Yeah. We really have had a pretty consistent increase in usage.
Is there always a drop in the summer months?
Often, yeah.
Probably just due to employment opportunities.
Um. Again, that's data I would love to have. I'd love to know why that happens in the summer months and be able to plan for that. A couple of inferences. One could be that the unhoused are housed throughout the winter, right? During code blue season, and then they come into the pantry for items that can be taken to a motel room and heated in a microwave. And often in the summer, those same people, if not housed, are a little more transient and don't necessarily have cooking facilities, using potentially soup kitchen, things like that. So that's one potential inference for why it drops in the summer.
When these families come to your facility, are they allowed to come weekly, monthly?
They're allowed to come monthly. Yep. And they get 3 days worth of food for the entire household. So if the household is 2 people, they get 3 meals and snacks. 3 meals a day and snacks for 3 days for 2 people. If it's 6 people, it's the same for 6 people. And we have switched, I think I might have reported this last time, but we have switched the function of our food pantry to be a choice pantry. People are actually selecting the items they want instead of just being handed a box of food. A little more dignity in that, but also much less waste because people are actually choosing the things that their family will eat. We've always asked questions, but this is a little more personal. Anything else? Yeah.
And working with get reimbursement through their system?
Yes,
Okay.
yep. I did send in an application to Healthy Alliance. Honestly, kind of cast a wide net because I don't know if you did that, but there was so much, so we'll just see where we fit exactly, and been trying to determine which piece, because as I understand it, you can't be services that you already are billing something else for, so anything that we could increase some services, but there, have to be careful about that, but we are looking to participate with that for sure.
Wait a minute, sir.
Yeah.
Did you say that people can only visit the food pantry once a month and they get 3 days worth of food?
Yes. I did. And the only thing, forgive me, sometimes my memory, I really, at one point we were at every 2 weeks. I think we've gone back to once a month. And that is pretty standard. A lot of food pantries do this. And the 3 days worth of food is a regional food bank requirement. We have minimums that we have to meet as a regional food bank pantry. And that is that 3 days worth of food per person in the family. We're pretty generous with it. We try to be without being unwise as well. So I will double check on that and I will send, if I'm wrong, I'm pretty sure we're at 1 month right now. If I'm wrong, if they've gone back to 2 weeks, I will send you an email, let you know.
Thank you.
Yeah.
So generally through 2024, household stays plus or minus 10% per month. But when we get a new family, it's always like 10 or 20. Does that mean 10 or 20 households are dropping out too?
Could be.
So they're constantly rotating. Okay.
Which again, would love to have more data about the reasons for that. The hope would be that those families that have dropped out have gotten services that they needed to help them move forward. And that, it's not a revolving door, but a door that's actually helping people make some progress. We'll know more hopefully very soon. All right, so we're also reporting on our transportation program. So that's the next one that you see. So these are our units of service for our senior transportation for July, August, and September. Just for your general information, I'm not reporting on October because normally I would report in October, but it was your financial meetings last month, so I bumped it, we bumped 1 month, but these are the reports that I had requested from our directors, so. Total units of service for grant year to date, it's just over 2,400. The ADRC, total units of service year to date is a bunch of twos, 22. We have some new clients, 145, ADRC. Lots of miles. The second page is the outreach that we are required to do, and we also are required to do by our contract, but it's also obviously the only way we're going to get our services out to people, so. Our transportation coordinator, Barb Corkin, is very involved in the community and reaches out to everyone she can find a way to let people know that we're here and what we do. And so these are all the efforts. This is specifically the outreach, July through September. That last page is specifically her report of what she has done over those 3 months to do outreach. This doesn't include any general social media or anything like that we do, but these are specific transportation outreach efforts. Yeah.
Is this contracted transportation when you're using cabs or Ubers, or you
No.
guys have your own?
We have our own fleet and we have drivers. We have some beat drivers and I think 2 volunteer drivers. We do prioritize when there's conflict, when we're short. We prioritize medical appointments, but we are there to get social engagements, grocery shopping, care appointments, things like that. Just do all kinds of things. And I do have some letters, testimonial letters as well. I did not include them in the packet, just, it's a lot. You didn't need another 5 or 6 pages of that, but we've got some great testimonials from individuals talking about our drivers and how thankful that they are for their assistance carrying groceries. Sometimes it's as simple as easy to talk to and happy to see them, you know. Sometimes they name them by name, sometimes they're just really glad to have had the service. Those reports also, those testimonials also tell us how people have learned about our services. So a lot of them were direct referral from other people that have used our services. And I'd be happy to send any of those along that you want, just didn't want to inundate you with paper today. Any questions on transportation? No? Good.
Thank you.
Thank you very much.
Hey, Cheryl.
Sorry. Shelley, did we have the contract for the food pantry that we wanted to bring forward also?
Oh, I was planning to bring that next month. Oh, but I did send it to you, but it's, well, yeah, what we were looking for. I can real briefly, so the contract for our food pantry that we have in Washington County expires at the end of the year. And it was about $42,020, I think. It was kind of a weird number. What we'll be presenting next month to you is proposal for a renewed contract for 1 year for $40,000 for the year. Just leveled it out a little bit. It still seems to be about the shortfall that we have, but as I mentioned, our fundraising efforts are increasing. We're working hard to try to bring those in, and we're hoping to be able to continue to reduce the need for the county, our need for county assistance in the food pantry. But that's what we'll be bringing up. Melissa already has a copy of the contract. I'm happy to send it along ahead of time if you'd like, but I'll be bringing it next month for a resolution to go to the finance committee. Any other questions?
Mr. Pearl? Sue?
We'll start with STSJP, And that is the Supervision and Treatment Services for Juveniles Program Annual Plan that both DSS and our agency collaborate with and get together. There is a cost component for a 62 state, 38 county component for that. This is the programs that support several of our youth bureau programs, including PYD treatment, youth employment, our JCR program, parenting program, which I'll discuss, and several raise the age programs are within that, like our juvenile electronic monitoring can be funded with using raise the age funds, which are 100%. So I'll talk to you a little bit. My ask is that every year OCFS, if there's leftover dollars from other counties that are not going to be used, they offer it up to our county. Tammy had asked for permission for us to potentially apply for those funds if we had services that we could utilize the funds for. They were accepted by the state. We indicated that we could use program support services, which is a broad range indirect service. And those are things we've used these dollars to pay for things like to support our youth employment program. And we use, as silly as it is, we buy a t-shirt, a bright yellow t-shirt, we put youth bureau and crew. And when we do projects like working at the fairgrounds, they all wear their t-shirts, or if we do something, a specific project within the community, they wear their crew shirts. Not every project, but so we buy things like t-shirts, incentives that are used as a behavior modification tool for those in our program, and or as you did a great job today. They get a $5 McDonald's card or Dunkin' Donuts card. So gift cards, incentives. We would like to purchase some of those rubber bracelets as a copying good kind of campaign so that we can, when we see positive youth behaviors, we can hand them out at maybe some of our youth programs and that type of stuff, and employment readiness supplies. So things like resume paper or items that they could use as part of the youth employment program. They have to interview with us. They have to go through all of those work ability kind of components. So I would need permission to purchase the program support items. So that's we're under the STSJP.
Motion, Dana. Second, discussion. All those in favor? Aye. Opposed? Motion passes.
Thank you. And then under the same STSJP, we contract with Cornell Cooperative Extension to provide the parenting support programs for our JCR youth. So I would ask permission, which is also in STSJP, for a total dollar amount of $8,000 to continue and to contract with Cornell Cooperative for the $8,000.
Nate, discussion. All those in favor?
Aye.
I got a question.
What does Cornell Cooperative provide for their services? They have so many things they can do.
Yes, so they provide parenting classes. So anybody that we have in our programs, clearly parenting is definitely a topic that is something needed. So our JCR program parents and or our pre-PINS components, we would make a referral to Kathy Sweet in our office. She actually has office space in our office. We would make a referral and she would meet with both the youth and the parent together to kind of work on those core behaviors or core ingredients. And then she'll meet with the parents separately to go through some individualized parenting skills component, and anything from setting appropriate boundaries to, it's not your child, to setting some guidelines. So she works with, last year, I think she served 16 of our youth, of course, they always have siblings, so we're always concerned about those next down the line. So 16 of our youth, but the parents that she supported was the 16 plus, a few of them had 2-parent households, so 20-ish. But then because Kathy is also in our office, we use her for, system of care collaboration that we're working with. We're working with Whitehall School. And she's been willing to go to Whitehall School and or Hudson Falls School to do some group parenting components. So when the guidance officer or guidance counselors get a group together, she's willing to go do some individualized group. It's not necessarily exactly what we're paying for, but we always utilize her for that kind of component also. So that's in a nutshell what Kathy does, along with providing us with some resources to give to parents in our parent handbook and that type of thing. And she has like open office hours, meaning a parent can just, we always give out that a parent can just reach out to her, even if they don't go through the official referral process. So, yeah,
Yeah, it does.
okay,
Sorry, I asked a lot of questions.
that's okay.
How do we know how successful it is going with these kids?
That's a great question. And I would say we really probably need to decide how to track that better, but success is definitely because if their behaviors reduce. So for our pre-pins program, if their behaviors reduce, if their parental strife is causing them to have behaviors in school or not going to school, or attendance is an issue, we do track that for other programs. It's not completely tied to specifically their behaviors because they went to parenting, if that makes sense. So we're hoping that all of the interventions that we do will then address the need for that particular kid, whether it's attendance, whether it's behaviors, whether it's other risk-taking behaviors like substance abuse or any of those things. The parenting piece is a huge component because parents need to parent. So, and they don't always quite know how, as strange as that is.
And they're receptive, right?
They are receptive. I would say Kathy has a way, to make everybody feel like it's not that we're sending you to parenting classes. Everybody needs help. Like I need help. Anybody who has a child or who is responsible can use some help from time to time. So she just has a way to get parents engaged. So that has not really been an issue. Even our PYD pre-pins program is a completely voluntary program. And I think I had, I think we have an 80, I had it here, on 89% of the people that are referred actually open up. Let us into their house, talk to us about their needs. The kids then start going to school or behaviors improve, and I can do a report. I should do a whole report on SDSGAP programs. I think that could be beneficial because there are a lot of challenges these days with kids.
What happens to the other 11%?
The other 11%, those
End
are,
up with me and family.
they do, they generally do. I would say the majority of those 11% that don't open up then probably end up going into a full-blown PINS case. And then either through PINS, they either may end up even rising to that level of the JCR program, or their behaviors can be adjusted, and then they would go to family court, depending on the issues. So STSJP, the concept is early intervention to alternative to detention, kind of like line. And we have some programs that address at those intercepts along that continuum, with probably for our purposes, the juvenile electronic monitoring being towards that. This is right before you're going to go to Dan and going to go to detention. And we know the costs of detention dollars. Tammy, did you have something?
Yeah, if I may, if I recall, I came to learn social services. Me too. We do a great deal of work, collaboration, and it really is with the Youth Bureau on alternative sentencing. It really is, it speaks to the continuum of services that we provide across the county. It's really part of the county plan that the chairman signs for our overall management of child and families, children and families, and the needs that they present. So part of one of the other collaborators in this, or that gets involved for department wise, would be probation. So a lot of it could be when she's talking about pre-tins, it's challenging behaviors in a home perhaps, or maybe something in a classroom. Pins is persons in need of supervision. It is sort of a precursor, or can be, if you're not successful in bringing those behaviors down, to involvement in the juvenile justice system. So it's that sort of continuum. If we're successful, we don't see them in the juvenile justice system. And that's where we pour so much of our effort into, is that preventive work.
That's definitely the goal, not to see them in the juvenile justice system.
So if I'm understanding this right, you have kids on electronic monitoring before they go to court? It's not a court order
No,
thing?
so we would have, most of the kids that are on electronic monitoring are through the probation department and a referral. But we still can use STSJP funds to support the electronic monitoring component, because there is a cost to that, paying for the equipment and all of those things. So that's what I mean. So the alternative to detention would be, Dan at family court, the judge, ordering them to be part of electronic monitoring instead of going to detention. And then we can use some of the state funds to offset those costs. And then if they're raised the age youth, and that's 16 to 17, and some 15-year-olds fall into that, as strange as that is. If they're raised the age youth, we track whether those youths referred on electronic monitoring are raised the age. And then there's a dollar amount that we can charge back to the state under raise the age that is 100%. So we get STSJP funds, we build back raise the age funds at 100% when and if possible, and we track those youth so that we're trying to maximize those state dollars to the best of our ability.
And again, both STSJP and raise the age in the instance that she's speaking of, raise the age, those funds actually go through DSS.
Yes,
We are the ones that claim them, and Youth Bureau bills us.
yes.
And that's how the cleaning process will work, and we'll bring in that revenue for that. But we are required to tie out all of our services for STSJP with also raise the age. The two plans, they used to be two separate plans, they still are.
Yes.
But they need to mirror each other between those two plans. And if we're even off by 1 cent on what we estimate for services, they will request us to make a change in one or the other of the plans.
That's a nice general overview of STSJP planning.
Okay, so we have a motion on the floor. Right?
What's the motion?
Guaranteed services contract with Cornell.
$8,000.
So motion and second was,
Aye.
any more discussion? Aye,
Aye.
opposed, passes.
Thank you. And then the third thing under the SGSJP is about our youth employment program. And I'm thinking this is going into our 4th or 5th year of programming. And for several years, LEAP has been gracious enough to do all of our payroll for the program. And we pay a certain admin percentage that gets taken out of these dollars. So my question to the treasurer and the county administration and a little bit to personnel was, would it be possible if we try to do this in-house? So I've just had preliminary conversations about whether what that would look like if we were to put them on our staffing pattern. We only have a certain amount of dollars. This year we have 25,000 $10.91 to pay youth to do the youth employment program. And then if you factored out the 10% that we pay to leave, of course, that impacts the number of dollars that the youth can work. My preliminary conversations with personnel have been that potentially it could be a grade 7 laborer, which would be an $18.77 an hour, 20% fringe, which was another additional $3.75 for a total dollar amount per youth per hour would be $22.52. They would just be considered part-time, nothing over 20 hours. They would not work over 20 hours. And so I didn't know if that was potentially something to pursue moving forward or what that would look like. Go ahead.
What's the fringe for?
So because we would need to add a certain number of slots to our staffing pattern, similar to what I think they use for the lifeguards or that kind of concept. So a pool, because we don't know necessarily how many kids would be working each year. We don't have like 3 spots and they have to work 20 hours. We like to meet the kids where they are. So if they can work 1 day a week, great. You know, they can really build their employability skills. So, so if they fall under the county realm, they would have the option of retirement, like.
Joining the New York State.
Yes, so that would be the $3.75 if they were to take that option. So we will have to factor that into the cost. Now, in the past, for the last 2 years, we've had dollars through another grant that we've subsidized for youth employment. So we use whichever one kind of makes sense to use. So we had additional dollars of $15,000 that under our rural community of practice grant to, and this year that grant is ending. So we will not have any more of those dollars to kind of offset some of the STSJP. You know, we try to maximize as much as we can to kind of provide the service. So preliminarily, I've had that conversation with personnel. We've had the conversation with the treasurer's office as to whether they'd be willing to do the payroll piece. And was willing to do the payroll piece. Of course, Melissa was involved with that conversation. So I guess I'm asking whether to move forward with that or not.
Does it have to go to finance?
If we're to create this pool, of 15
15,
laborers, I believe,
yes.
so we'd want to add 15 laborers to your staffing pattern. That would go through personnel and then to full board to change the staffing pattern to allow her to be able to utilize those positions as you need.
Right, and it would be, maximum would be the dollar amount that we have in this pot of money would be the dollar amount that would be used.
So you need a motion to send this to personnel.
Yes, I
So
think
moved.
so.
Second. Discussion.
Side question, what types of employment do they involve themselves in, or do you involve them in?
So we work in crews, so we have our staff, one of our staff is a crew. So the 14 and 15-year-olds that are limited based on their age to what type of activities. But last year, and then 16 and 17-year-olds, we have several, we take care of a couple cemeteries in the county. We do a lot of painting projects right now for those 16, 17-year-olds or the older youth. We are painting the Greenwich Town Park building. I always forget the park name, but we're painting the
That's what
outside
I
of,
said.
yes, thank you. We're painting that project. So we do painting. We painted the fence, the youth painted the fence in Fort Edward along the town. We do some raking, things at the fair. Of course, we do a lot of work before the fair and after the fair. We clean a lot of the buildings, the dorm rooms, the 4-H buildings, all of those types of things. We generally work depending on the number of hours and depending on the youth that we have. We generally have 4 or 5 that are 14 and 15, 4 or 5 that are 16, 17, we can serve up. They can't be over 18 for the STSJP funds. So it's really anything from, you know, any type of activity that we find for them to do. We do a lot of grounds cleanup, car washes, for the county, car wash, the garden, our garden behind Pleasant Valley Infirmary. We do some work at our garden. And of course, that cemetery, the Portland Cemetery, is one of those that are on our rotation that we take care of. So you're welcome.
So, all those in favor of the interpersonal
Aye.
I feel like
opposed?
I feel like I
Motion
have
passes.
a lot today, sorry. Rural Communities of Practice Grant. We are nearing the end of this grant, and this was a grant that was a collaboration with Warren County, and it was a DCJS grant that started in 2022, and it was a delinquency prevention program, and it is a difficult grant to manage, for the state. However, it has allowed us to support several of the programs. I mentioned some of the funds were used for community service, for the juvenile employment. Some of the youth funds have been used to purchase our interactive journals that we use with youth, and that's a cognitive behavioral tool that we use. So within this grant, we have $3,977 left that are unspent. And we would like to purchase an online curriculum through the Change Company, which is where we get our interactive paper copy journals. And it's called Atlas Programming Platform. And it takes the journals into a virtual format and allows people to just be assigned journals. They can complete them on their phone. So that is the platform. For the $3,977, we would have 24 rotating slots, meaning we can have up to 24. Then when one person finishes, another person could go into that slot, and so on and so forth. So we would like to purchase the online platform for 1 year for Atlas Programming Platform.
This will be
This-
able to finance.
Yes, have you touched purchasing at all about that?
I have not.
I would suggest that, you do. I know it's not a huge amount of money.
Yep.
But I just want to make sure that, you don't have to go out that out.
How about IT?
So I would say we definitely need it. I don't know the answer to that, and I certainly will pursue the purchasing. We definitely need it to tie into the journals that we already, as far as I know, there's not another program, that online program, because they go hand in hand. So they go hand in hand with the journals that we already have in paper copy. It's just that we can also track them and do them online if needed, and assign people online if needed. So I don't know if that answers your question, but they go hand in hand with the same company.
Do you need a waiver for that to go with a specific company that's?
I would want to talk to the purchasing coordinator just to.
And we can do that in
We're all on the
finance
same page. It
anyway.
might be a source, and so, yeah, but we can, if the committee approves it, can go to finance.
Okay.
And that's just for 1 year. correct?
Just for 1 year, the 24 licenses, and it's the 100% under this grant dollars.
I'll move it.
Second. Any discussion? All those in favor?
Aye.
Opposed?
And then I have one more, and I neglected to bring this to the committee because I think it just became an everyday or an every year contract. So I did already sign this contract. It's with Hudson Falls School District to provide transition services.
And that's something that we've been doing for 10 years or more. And I neglected to bring it here first before, to get permission. But this contract is $20,000. We provide 5 hours of education or life skills kind of component for anybody who's incarcerated at the jail who is age eligible for schooling. They have a GED teacher that goes to the jail, Hudson Falls School District does, but they don't do the separate 5 hours. That's also a Department of Ed qualification or need. So we provide that service. Currently, I mean, really, it's a low number that end up being incarcerated, but it's 5 hours a week. Currently, we have 1 female that falls under that realm. And then we also, upon, if they have any youth that they want drug and alcohol evaluation, we provide those services and drug and alcohol awareness classes. They utilize some of our Court Solutions online platforms through Hudson Falls School. So that's the $20,000 contract. And I think this might be the 11th year, I should have looked that up, that they've been contracting with us to provide this service.
So we want a motion of,
Please.
and second, any discussion? You know, how many in the normal year, 5, 10 people at most?
Not even,
Single digits.
not single digits, 4 to 5. I mean, they are incarcerated for a long period of time generally, but really the number of youth is 4 or 5. And then as far as the awareness, or that might be another 5 families or 5 kids that participate in that type of thing. So
Reduce
roughly,
their time, benefits.
yeah, yes, yes.
So the 20,000 comes out of your budget to Hudson Falls School?
Hudson Falls budget to ours. So Hudson Falls pays us for it, for that service.
I like that better.
Yes, yeah. You know, I knew that probably it wouldn't be, yeah, the
There's
Hudson
one
Falls
yes.
pays us for it.
That's September.
Yeah.
All those in favor?
Aye.
Aye. Opposed? Motion passes.
Thank you.
Thank you, Sue.
I think that's all I have today. That was a lot.
That's a lot. Okay, public health, Tina?
Thing I have, are 2 resolution requests. The first one is to add the early intervention administrative grant, in the 2024 budget. That has a grant cycle from 10/1 to 9/30, so we just received, approval of that. The total amount is $38,779, with the majority of that going into the contingency fund because we already have the salary budgeted within our budget. So we're just looking for approval to add that to our 2024 budget.
They go to finance.
Yeah.
Please, so.
I'll make the motion.
Move that to finance, right? Yes. Okay, so a motion to move it to finance.
I second it.
Okay, names. Okay, any discussion? All those in favor? Aye. Opposed? Motion passes.
And the second one I have relates to our child passenger safety grant. This also has a fiscal year of 10/1 to 9/30. And we were awarded $16,700 this year. And again, that's to purchase car seats and do child passenger safety programs. So just looking for permission to add that to our 2024 budget.
So once again, we want this in finance. Motion, Scott. Second, Nate. Any discussion? All those in favor?
Aye.
Opposed? Motion passes.
The next thing, I just have a couple program updates. And I just wanted to pass this around. I was asked to bring this just for awareness. This is I don't know if you want to call it a substance. It's a new, it's called Kratom. It comes from tropical tree native to Southeast Asia. We are seeing this within our area. There is legislation out there right now in the Senate, to make it illegal to purchase if you're under the age of 21. So I just wanted to make sure that you were all aware that this is out there. It is an addictive substance that is being abused, but it also does have positive uses as well within moderation. So I'm just handing you out so you have information on it, and that so you're also aware. I believe Melissa was approached and kind of called our department to see if we had heard anything out there on the dangers of this. So I don't know if you had anything to add to that.
Senator Ashby actually approached us with a bill that's out there asking for support of that bill. So do we have, I don't know, Chairman, do we have a copy of the bill that he's looking to?
Yes.
And
I have a copy of it
He
as
was
well.
was he looking for a resolution in support of that, or?
He was, I don't think he asked for a resolution per se, we could certainly do one. I've got to go, I'm not sure if he's got a companion bill yet.
So we'll keep an eye on that. So we can see the
Be
progress.
something to consider in our efforts on the legislation.
Yeah, right now, it's not a controlled substance. It is a drug of concern, as labeled by the DEA. So it was more for awareness that I wanted to bring it to you. I did speak with the sheriff's office, to see if they had seen it as an issue out in the community. They have, but not to the extent of like opioids and that. So, just really bringing it so you're aware that that legislation is out there. There are several states that have banned it completely. I think there's 6 states in the United States, including Vermont, that have banned it from being sold at all, within their state. And there is one county in, New York State, Suffolk County, they've issued their own local law that it cannot be sold, or distributed to anyone under the age of 21, within their county.
And in the meeting that we had, they
So
actually,
it's
one
not
of
an energy
the,
drink.
that it's actually something that's sold by a lot of convenience
It
stores.
is.
and in stores.
It's
available.
in stuff, that you're buying, and, it's, available, I know you can get it at Amazon, it's in the convenience stores, so just for awareness. Any questions on that? Yep, the next thing I just wanted to bring to your attention, we have, Eliza's been making great progress, with our farms, to try to get out there and do the flu vaccine. We have 5 farms scheduled, we have 4 scheduled, 1 pending to be scheduled. So I think you've all received something in your email, a flyer, you could, hand out or give out information on, really trying to promote those clinics, this year, to get their workers and family members, vaccinated, for flu. The next thing I did, the Burgoyne move, I did have to put a request into New York State Department of Health to extend our construction start date, because of the bidding process. So I did receive approval back that they did extend our construction start date to January 1, of 2025. They also extended the other dates, so they would like our construction to be completed by August 1st, and then the project completion date of November 1st, which means that gives them from August to November to come up and do their inspections, and make sure that we're all good to move into that space, for our operating certificates. Any questions on that? And then I guess the last piece of good news that I have, we are fully staffed, even our nursing staff. So that's been a long time, since we've been fully staffed. So just wanted to share that with all of you, and it's exciting for us.
Must be the new,
What's that?
must be the new leader.
I don't know about that.
Great. Good talking.
Any other questions for me or? No? Okay, thank
Thank you,
you.
Okay, social services center.
first thing that I have on the agenda today is for a resolution in your packet. It is to recognize funds that have been passed along to us as a result of the 24-25 state budget. There was $10 million appropriated. Washington County received 33,440. The intent for these funds are to be able to pass on to households that are either in receipt of temporary assistance or would be eligible for ongoing or emergency temporary assistance to retain their housing.
Accept. Second step. Discussion. All those in favor?
Aye.
Opposed? Motion passes.
Thank you. I will just add that this will offset it. Generally speaking, there are times when we would be paying arrears for someone to be able to retain their household, so it's only $33,000, but until it's gone, then it at least means that it's funds that we are not having to spend of state of county dollars. And Al, I was asked by our finance professional if we could be put into an appropriation that would be available for a quick turnaround for the payments to the landlords and not subject to the full audit process. That's something that you're able to assign a number for.
We talked about that before finance, to see if there's anything.
Then I'd like to request a waiver from the purchasing policy in the area of professional services. Previously, we had contracted with Pall Mall Broadcasting for digital and radio advertising. We want to change our audience to a different radio station. This is for the purpose of foster care recruitment. We would like to contract with Adirondack Broadcasting. That's Froggy 100.3. It's more, it's a bigger listening area, closer to this part of state, I guess, as opposed to the eastern border, which is what we had been with before. So we had negotiated with them, asked them for a quote, then worked with them further. They reduced it by 50% for us. So at this point, what they're asking for is $6,720, and they're including a match with the ads will also be on their Classic Hits Q 101.7, which is the station that's on our county hold line. When we had the previous ads, I asked if our hold line music could be changed, and apparently there's been some pushback about that. So the people that listen to it in-house would prefer to listen to a different radio station. So this is the one that actually is our.
Zeppelin Sue's voice down this morning.
So I think we're probably back to the 101.7 now, from what I understand. So
So how does that amount compare to what we're paying?
it's a reasonable, it's less, because with the Pall Mall, we were also paying for that digital advertising that we haven't found to be entirely successful.
So we have a motion to approve. Change.
Does that have to go to finance?
A waiver from.
A waiver from our, yeah, from the procurement policy.
Oh, okay.
And everything you do here.
Yes.
Second step. Any discussion? All those in favor? Aye. Opposed?
Thank you.
Motion passed.
Thank you. And the heat season is upon us. It's scheduled to open on Friday. I hand out one of these informational sheets and ask you to feel free to copy it, post it, share it on your socials. This has just been updated with the numbers for the 24-25 season. It gives a little, a brief summary of the information about it. And gives the eligibility information is on the flip side. The one thing that I will say about this year that caught my attention as being different. Usually, we understand when they open that they may then open an emergency benefit as well sometime later in the season. And we've already been told
that not only will there be an emergency, but there will be two emergencies. And they are both going to be available effective January 2nd. They are not supposed to be tied together in terms of a delivery. But it seems to me scheduling that out for people with the amounts that are covered for people who are eligible, that is a great benefit for them. We have not been able to take any applications for the program yet. We will be able to do so on the 1st. There are people who had received the benefit in the past that are automatically qualified going into this coming year. Any questions on that?
That's 100% funded by the state.
It is. Yeah, it's actually federal money that passes through. Yep. Yep. So then moving on for updates, I wanted to share with you that we've been notified of a couple of other funding allocations that come through related to the state budget. We were notified earlier this month of it's federal funds. It's Child Abuse and Prevention and Treatment Act, and then they add in that it's Comprehensive Addiction and Recovery Act of 2016, and it's in the state budget. So regardless, it's the minimum amount has been $50,000 moving since we've had this, which has been at least 5 years now. I just went through in my head that it's the act from 2016, so it's at least 5 years. We use this to pay for generally either a CASAC or someone who is tied into the profession of substance abuse counseling. We have always had somebody in our office that has been available to work with referrals for people that come in seeking benefits from us that we screen as having an issue with a substance. This widens that bracket out to also including that we could have somebody go out with our child welfare caseworkers and meet with people in their homes. So that is the contract that we have. The minimum allocation, however, was increased by $20,000. So they're providing $70,000 now as opposed to the $50,000. We will use that to offset the cost of our contract. Also, we were notified this month about funding for Code Blue. Most of you will remember that Code Blue is what is called as an emergency situation when the temperature drops below 32 degrees, including the wind chill factor. At that point, anyone that is homeless and isn't already otherwise eligible for temporary housing assistance would be deemed eligible through Code Blue. We contract with the Open Door Mission for shelter space for Code Blue. When there are families or if they reach capacity, the folks would then be sent on to motels. So we would use the Code Blue money to pay for that as well. Last year it shifted to an allocation as opposed to being based on a budget that we had to work out and submit to them. So this year, what we have been allocated is $386,281. The contract that we've signed with Open Door for the season is $290,265. So it seems like we're in a good spot for that. Again, that is 100% funding as well. If we, however, were to request more than this, we would have to go back to the state and ask for them to reconsider how much we need to make our case to them for that expense.
Does Open Door have a facility in Washington County?
No,
Just the one-on-one?
yes. They have dramatically increased usage within that space, so it is a really nice facility if you ever have an opportunity for a tour there. Also, still continuing on with the theme of funding, APS, Adult Protective Services, ARPA funds. That is funding that had been released in the past in two separate allocations. I would have talked with the committee about it at that time. It went back into early stages of the pandemic. We purchased computers at one point that were utilized in the adult services area in the ADRC. We've also, more recently covered our shelter bed contracts with with those funds. We've taken advantage every time that they've offered the funding, and also when other counties have not spent their money, we have also asked for redistribution of funds. We were supposed to have that money, spent out by the end of the month, but they let us know that they have received approval to extend it. And now the funds are due to be spent out by the end of August of 25. So we've requested more funds. And at this point, we were debating what we should use that money for. Gina had, knowledge of, a medical QR bracelet, which hopefully you would be able to answer any questions about that, but we were looking to buy a large number of those, as well as then paying for our shelter beds that we have the contracts with. So that totals out to $169,688 that we've asked for. And so far, they have not denied our requests. So I'm hopeful that we'll receive that as well. That offsets county dollars as well. Good information on funding for once.
Question.
A question on our 290,000 for open door.
Uh-huh.
That's just a number, but how many bed nights is it, or something that you can spend per person per night, and how huge is it?
They have a certain number of beds, and then they have like their regular area, then they have another area that they open up. They have for different genders. They also have for overflow that people could be in their like dining room area, not necessarily with a bed or a cot. I do not know what they computed for this, but they went through what their expenses have been, estimated that space, the staff that they would need for that, because they also have security on hand as you know, for running this throughout the night. And essentially that cost is our share for half of their operation, the other half is being billed to Warren County. So that's I don't know.
Yeah, it's spending nearly 600,000 more in Washington County for lodging. I don't know how many lodging nights that accommodates.
Yeah, I can pull the budget and see what their formula was and share that information with you if you'd like.
Nate,
If you have someone, say, in Greenwich, who is homeless, and they're requesting this cold blue, is the county responsible for transferring them up to that facility and then taking them back?
Usually the way that they access the system after hours would be through generally law enforcement. There is a requirement upon law enforcement to be available to help people get into the safe situation during the cold weather like this. So generally what we have found is they will assist us in transporting people. It's the quickest way for them to clear out of that situation that they are dealing with.
But then when it warms up and they want to go back to the spot they were, taken from, is it the county's responsibility to get them back?
I do not believe so. I'm not aware of us assisting in that way at all. Totally.
Tammy, given that we're shipping people out to Warren County, there's an organization in Washington County that wanted to become open shelter. What would the process be if they didn't follow?
They would have to look at what the requirements are, the regulations within the licensing authority, which is the Office of Temporary Disability Assistance.
So it's a
We
state-
would work with them, yes. Yes, we would work with them. We would happily work with somebody within Washington County. A provider that would be interested in doing that.
Am I correct, this initially, when I heard about the first time, I had to be on the bus line too, right, or something? I mean, isn't that how we ended up there?
I'm trying
Seems like
to
that
come
was
up with
one
what
of
you're
the
thinking about.
criteria. So they could get there by bus, whatever. I'm thinking where it's
There's
located.
somewhere in history, we have had a conversation about opening something and that it would be most logical to have it on the bus line. I don't recall it being about
Code Blue. But yes, it
Seems
is,
like that's what I remember.
okay, I can't argue that.
Anything else? Thank you.
I was quicker than Youth Bureau.
Well, once.
To be fair, this is gonna be tough to beat that one.
Okay, mental health, Harry, I guess you considering for Rob? Welcome.
The original resolution Rob sent forward to increase the state aid and to increase the 100% OMH funding was originally for $11,997. But that was proved to be, that's not the correct number for 2024. The correct number is actually 35,991 for 2024. And this money is to cover a stipend that the state is giving to I think it's 31 beds that are operating under Ascend or Association for Mental Health in Washington County. You don't call it a COLA, it's a stipend. It's about $1,548 per bed that they hand out. They award each of the counties. And we would just like to see if we could just change that 11,997 to the 35,991 under the 100% OMH contract, and then the mental health state aid. It's fully covered. It was just an error. It's the stipend came effective 4/1 this year, so that basically is 35,900 for 3 quarters. The 11,000, actually the number that was originally, that's the 4th quarter, that'll go into 2025. So basically, we just wanted to make that correction without having to go through all the paperwork again. Any questions on that? I mean, it's all state funded.
Right, is that kind of,
Yeah, I'm sure it's gotta go to finance to be added in the budget, but is your budget accurate for 2025 or is there something?
No, this is money just came in after we had filed the 2025 budget. So normally, it's not unusual for this to happen with OMH and the OH system, but then we just wait till 2025 and take care of everything else, sometimes more funding comes through. So we just take that approach. As long as we do it the current year. I mean, if you want to do it differently, I just thought, once we submit the budget, we start acting on it, then we have to wait.
Okay, so just so I'm clear, there's 2 resolutions in the packet, you disregard the first and then one with the 14 in the second.
Yeah, the 30. Yes,
Okay, so disregard the first one, so 11. So
yes.
so a motion?
That money will come after the first of the year, the 11,000. Did I understand that right?
Well, that'll be advanced. They do it quarterly advances to OMH. So eventually-
So we're looking for a motion. The 35,991
I'm over.
finance. Second David. Discussion, all those in favor?
Aye.
Opposed, motion passes.
Thank you.
And one other item? Wait, it's another item?
Oh, yeah, Rob, I'll have to get back to you on that, but I think a lot of the details, we got some of the details, but the funding and a lot of the other details, he has to get a little bit more information. He mentioned he'll be back once we plan a little bit more, once we get more information. It's a work in progress.
All right, thank you. The other business, I think Gina would like to speak to us.
Good morning.
Morning.
Supervisor Tom, Gina Cantucci Mitchell, I'm the director for Washington County Office for Aging and Disability Resource Center. You heard Tammy talk about ADRC, that also incorporates our department as well. So based on a request of about some comments and some information that was shared recently by, I believe, some senators and assembly people. I was asked to invite Becky Cravey. She is our Association on Aging in New York Executive Director. And so I invited her here today to talk about and share some of the statistics that I believe was presented at a recent event. It's okay.
Becky, why don't you come up here?
I will go wherever you tell me to, sir. And now that Tammy made this into a race, I'm gonna try and talk quickly.
She raised though.
No, for timing. First and foremost, I want to thank all of you for having me. I believe I was here last night for your Older New Yorkers Day celebration. And just to share a little bit with all of you, I brought quite a bit of information, but Dina had reached out to try to talk about what we're doing at the state level to try and alleviate some of the burden that's coming down on localities, county and local governments, and what work we're trying to do at the state level to kind of rectify that. So as Gina said, I represent the 59 area agencies on aging or offices for the aging throughout the state. Most are within county government. We have 2 that are not-for-profit independent structures, and then 2 Native American Indian tribes. So we're one of the largest networks actually in the country. When you look at the state of Georgia, there's actually only 4 AAAs in the entire state. So we're very unique in that sense. I will tell you, selfishly, Gina is a board member of mine, and she runs an absolutely amazing program if you compare her side by side with other directors in the state. So the minute Gina asks me for anything, I will jump because she really has a fantastic model. The collaboration with Department of Social Services is very unique. You don't see that in a lot of other counties. And she does a ton of work as a board member on advocacy. So not to go too far into the weeds on this, but I think part of the conversation that we had with some Senate and Assembly members in the last couple of weeks were part of the reason that I was asked to come. And some of the statistics that I shared, and I'll just give you kind of a holistic view of the state budget in and of itself. So New York is home to about 20 million people. Of that, almost 5 million are over the age of 60. We have another 4.1 million that are caregivers. So you're talking about almost half the population is either aging or they're dealing with an aging loved one or a person with a disability that they're supporting. When you look at that number, it's kind of staggering, right? With the actual demographics of the state. And I shared Washington's with you. You're losing population in every other cohort other than those over the age of 60. And I will tell you, not only in New York State, but also nationally, individuals over the age of 80 are the fastest growing segment of the population. So the care ratio of younger people able to provide care is decreasing in every county in the state. Most specifically upstate, you're seeing it pretty significantly. The reason why that's important is we have a ballooning Medicaid problem. I don't think anybody feels that our Medicaid, being at over $100 billion per year is something that's long-term sustainable for taxpayers. So how can you address this Medicaid problem to really have Medicaid for those individuals that are higher needs, that need those more intensive services? And that's really where our network comes in. We're pre-Medicaid. So roughly speaking, in the state of New York, if you're a single individual and you make $1,700 a month, if you make over that $1,700 a month benchmark, you don't qualify for Medicaid. Well, what does that mean for a client that Gina's serving that's 75 years old, makes $2,300 a month and needs a home health aide? You can't afford to privately pay $40 an hour for that home health aide, but you can't qualify for Medicaid. We subsidize those services in the middle. The reason that we do so much on the advocacy front is we really feel that offices for the aging are not funded equitably. And when I say that, older people in the state pay $72 billion a year in state and local taxes, $72 billion. The New York State Office for the Aging budget is only a little north of 200 million with an M. So even though older people are paying the majority of taxes, the service infrastructure that supports those individuals once they're older really doesn't receive the level of funding that's equitable to other service infrastructures in the state. Unfortunately, the federal government gives the least amount of dollars for aging services to all of the states. So the state gets around $90 million in federal funding, which Gina obviously gets a component of that as well. States a little over the 200 million mark, but the localities, the counties, are paying $372 million in local share. So the counties are paying the most amount of money for Office for the Aging services. Gina, I believe previously kind of outlined to you guys, there's a required match for some of our programs. So the county is responsible for a certain investment to draw down those federal and state funds.
you guys are way overmatched, because you really care about the population, and your program infrastructure is really robust. So what we're doing at the state level, and we work really closely with New York State Association of Counties, so I'm thrilled to announce that NISAC, I don't know how involved you are with Steve Aquario and Ryan Gregoire on advocacy. Aging services is their number 3 budget priority this year, out of a very robust ask for an influx of funding, and that's due to a couple of reasons. One, we're going through a master plan for aging process. So we're trying to come up with a 10-year-long plan on how to make sure we can serve older people in homes and communities. The reason why that's so incredibly important is if you look at Gina's average client, or you look statewide at an average client receiving a home delivered meal, case management, or help taking a shower, health insurance counseling, on aggregate, that individual is a low-income female in their 80s that lives alone, that has 4 to 10 chronic conditions like congestive heart failure, diabetes, and needs actual assistance with taking a bath, going to the bathroom, going to the grocery store. We serve that individual, and again, this is all New York State data and part of the cost reports that Gina's forced to do constantly. We serve that individual for less than $10,000 per year on average. If you scored that person for a skilled nursing facility or assisted living facility, they would instantly spend down to Medicaid to the tune of $150,000 per year for that care. So if you want to save the Medicaid problem, let's invest in the service infrastructure that prevents people from ever having to spend down to Medicaid to get those services. What I've provided for you are statewide waiting list information. I continually indicate that the waiting lists are not reflective of the actual needs, because if any of you have had to reach out for assistance with a loved one, if you're told you're going to be put on a waiting list for X number of months, you might have to turn to another service infrastructure. I just did a home visit in the Capital Region through our advocacy line, and the individual was significantly over income for Medicaid, but needed a lot of home care and was waitlisted. What I did was a pooled trust with her, and I got her Medicaid within 30 days, and she's now fully on Medicaid, which is a 50% state share cost. So again, any way we can invest to try and contain those Medicaid costs, I think, is really important. A couple other notes, we've done the math on the waiting list statewide. It's around $40 million just to alleviate those individuals that are currently waiting for a home delivered meal or a home health aid. But a couple other things have happened in the last couple budget cycles. We've gotten no increase for inflationary costs. So you guys know this, the cost of food, gas, staffing have all significantly increased. We have not gotten appropriate inflationary adjustments for those services. We were also hit with a $2 rate increase for home care workers. And the nuance of that is Medicaid and GINA use the same licensed home care providers. So it's the same agency. We're just a different payer source. We're using Office for the Aging dollars instead of Medicaid. When the $2 rate increase for home care workers went into effect, Medicaid was funded well over, I believe the benchmark was like $800 million to absorb the rate increase. Offices for the Aging got $0. So it left a $7 million hole for people receiving home care services. And then we've also put together a federal plan, which Senator Gillibrand has helped champion on the Older Americans Act monetization plan, which would be having the federal government pay their fair share of this service infrastructure, which we're still going through appropriations, obviously, at the federal level with an election coming up. So a really lot of unknowns on that front. But I wanted to give you kind of the holistic state view. Gina, can attest to this. We meet with all members of the Aging Services Committee. This is a bipartisan issue. It's a cost-saving measure to the ballooning Medicaid problem, but it's also an equity issue because the people that we're serving are exactly those people that paid all those taxes, that worked their entire lives, that might have some limited needs, and can't access those services because of those very low income benchmarks. Another thing to note, and I don't know the bed count for your county specifically, but we're talking about almost 5 million people over the age of 60, with that being the most rapid growing segment of the population. We only have 111,101 licensed skilled nursing facility beds in the entire state. And the fill rate of those licensed skilled nursing facilities is about 97,000 patients because of the staffing issue that we have at nursing homes. So there's literally, without a community-based infrastructure to support people, there aren't even facilities for us to refer them to receive that level of care. That's very high level view. I also wanted to share just some interesting facts about Washington County. You guys can see from the demographic chart, you're losing everywhere except that 60+ population. I also wanted to share with you what older people in the county are actually contributing. A lot of the work that we do to combat ageism is to talk about the inherent value that the older population brings. And yes, there is a small subset of that population that has pretty significant needs, but overwhelmingly, we wouldn't have a state, local, or federal economy without people over the age of 60. So you guys can see 83% of individuals in the county over the age of 60 own their own home. Why is that important? They're sitting on massive amounts of home equity. If you look at the personal household income in Washington County by those over the age of 45, 71% of all household income is generated by people over the age of 45 years old. Social Security, over 217 million annually. And if you look at the personal household income, that's 65 plus, you have $485 million. So really significant driver of the economy. When you look at what volunteers are providing in Washington County, and you know, Gina utilizes volunteers, hospices utilize volunteers, food pantries. If you had to pay your volunteers for the service that they provide within this county, it would cost you almost $60 million just to pay the volunteers for what they're providing. And then if you look at caregiving, which if you look at national statistics, half of everybody in this room is currently in a caregiving role. If we had to pay caregivers in York County for the work that they provide, it would be $120 million. So the vast majority of older people in the county are significantly contributing to, you know, all facets of the economy, but it's really a time that we should not have a waiting list for someone to get a home delivered meal or a home health aid. So that's kind of what we talk about with elected officials. My organization, NISAC, we've met with the Division of Budget with Lake Washington. We've also met with the Executive Chamber on numerous occasions to try and ask for a significant investment in funding. To give you guys an idea, last year in both the Senate and Assembly one House bills, there was a request to address the waiting list, and we ended up not receiving, we received $700,000 in additional revenue on a $40 million ask. So we're working with local governments, we're working with the state and our members and county leadership to really try and make sure that in this budget we get it right. Because we truly believe that this is a value proposition that we need to move forward. So I know Gina's the secretary of our board, she says I talk way too fast. So I don't know if before Gina talks about the actual clients receiving services, if any of you have any questions about what we're doing at the state level.
So a couple things, there's a lot of these things are all tied in together, so the Medicaid costs, the part that gets moved down to the counties, of course, is substantial in every county. But I'm afraid when they don't look at it in totality at the state level, because it's getting passed to us, it probably doesn't get looked at the way it should. I don't think the analysis is correct. The second thing with NISAC is they're like a sounding board in certain ways, but the supermajority has kind of limited their ability to make things happen, which you actually got to see. And then the other thing is like with our local nursing homes, Andy Cruikshank worked really hard to try to get more money in. And the people that have worked here all their lives, they can't get, you know, you still give them $50 a month to wherever, and that's been that way for 50 years. So nothing's really changed with the times, and they're all tied together and intertwined.
Absolutely.
And I just don't know what our role can be to make that happen if NISAC can't even get them to talk amongst themselves because the supermajority controls that. So I heard the numbers and I wanted to hear more and how it directly affects our county and the population that's leaving New York. Is it those 60 and over, which is interesting because that's what you used to think.
Right.
And that's all changed, which shows up in your demographics, so.
Yeah, I mean, New York is 4th in the nation for the 60+ population, so, you know, we're definitely up there. But, you know, and part of what we're doing through the master plan for aging process is this is all a continuum of care conversation, right?
Yeah.
And it needs to be a continuum of care conversation, and we don't have enough licensed nursing home beds. In my previous work, I was the hospital discharge planner at Alice Hyde, and I was sending patients that needed bariatric care to New York City, which you could send them across the country, right? Or the equity issue of not being able to see a loved one. So we're really trying through the MPA to make the case that we do have a system that needs redefining and restructuring. And I liken this in many meetings to it's well known, if you can put people in schools and tell high school kids not to smoke and not to vape, it's going to save long-term health costs. Offices for the Aging can do the same thing, because, you know, I talked today about our really in-home programs and services. We provide a whole host of preventive services like chronic disease self-management, all of our senior center sites, Tai Chi for arthritis. But again, with a budget so small, you have to make decisions on where you direct those dollars. And, you know, quite frankly, the case that we're making, and we have made the last couple of years, and I'm very hopeful will resonate this year, is that, you know, older people are paying for every other system. They're paying for Medicaid, they're paying for the school systems. And we have a really defined, really cost-effective service infrastructure that can't be funded to meet the needs. And quite frankly, when you look at $100 billion versus, you know, a $40 million ask, we're a rounding error for division of budget on Medicaid. And that's why, you know, Gina's always great about, I believe, coming to the board to ask for resolutions to support the work that we're doing. And we're hearing, I knew it's early on in the budget, we're hearing that we're going to receive something. I just don't know what the something will end up being. But it's the reason we're out there talking about it, to really have people understand what the issue is and where we're trying to move forward.
That's great. Any other questions? Thank you.
Thank you. Just to note that I also included in your packet, it's cluster one services data. They call it cluster one. This is specific to Washington County. And again, they call it cluster one because these are registered services. So a lot of the services that we do provide aren't necessarily registered. People, for instance, can go to a dining site and congregate site and not necessarily have to register for that. So this is interesting information specific to Washington County, and it talks about our data from the 23-24 program period. So I encourage you to take a moment to look at this. And again, that a lot of this information is included in our annual report, which I usually share in March, April of every year. But it speaks specifically about those registered services, and it gives you percentages and demographics of the population that we're serving.
And I want to thank all of you again for having me. I will come to any function. I will come talk about budget at any time. It's what we're passionate about. And I really appreciate all the support you have given in the past for the advocacy that we have done. And just have to again highlight what an incredible job Gina does for the older residents of this county in partnership with your Department of Social Services, all the senior center sites, and what you do with the meals program through the jail. It's a really nice program to see. So thank you all so much.
Thank you. Any other business? No. Or general?